Well, good morning, everybody. Hello, my name is Daryl Gordon, and I'm Vice President of Marketing at MediKeeper. And welcome because this is our first webinar of 2026. So I'd say welcome back to our regular attendees. It's always great having you, but if it's your first time joining us, you can go back and catch up on all the other 32 sessions. They're all available on our website, available on demand. Today's session is 25 minutes. It's going to be recorded and will be available in a couple of days for you to view if you missed anything. Since 2019, MediKeeper has published an annual list of emerging trends that play a role in employee health and wellness. And today, Dr. Tyler Amell, the Chief Health and Strategy Officer at MediKeeper, is going to spend his time sharing details on the trends identified by MediKeeper. Dr. Amell, we're looking forward to the session.
Thank you so much, Daryl. I'm looking forward to presenting it as well. So, good morning, everyone. We definitely appreciate the opportunity to share some of our insights and thoughts for trends in 2026. This is something that, as Daryl mentioned, we've been doing for a few years now. It's something I look forward to every year, and definitely something that I know generates a lot of interest and a lot of discussion, particularly as people look to the future to try and anticipate what will be coming forward. From an affiliation and disclosure perspective, as Daryl mentioned, I'm Tyler Amell. I'm the Chief Health and Strategy Officer at MediKeeper. I'm also on faculty and the registrar at Pacific Coast University for Workplace Health Sciences. And I also sit on the executive board of directors of the Wellness Alliance. Some of you may know that was the group that we created after merging WILCOA and the National Wellness Institute together under the auspices of the International Foundation of Employee Benefit Plans. And I also sit on the executive board of the Work Wellness Institute, which is another group of like-minded individuals around workplace health, productivity, that sort of thing. My LinkedIn handle is on the screen. Please feel free to reach out. I'm very active on LinkedIn, promoting a lot of workplace health and productivity research, original research, or other useful tidbits and information from the broad topic of health and productivity. So everything from primary prevention, secondary prevention, tertiary prevention initiatives in the workplace, health benefits, pretty much everything to do with health in the workplace. So it's something that is a very broad category. There's lots going on there. And it's definitely an area of interest for a lot of us. So feel free to reach out. Also, my email address is there. If you've got a specific question or want to reach out for any specific need, please feel free to reach out and let me know. So as Daryl mentioned, we've been doing this for a couple of years now. And so usually what I do in these webinars is look at what we did from a rearview mirror perspective in the year before. Now, we actually released the 2026 trends report back in November. So it was actually released before US Thanksgiving. And so that is, it's been a couple months since then. And I'm glad to say that, we're right with regards to everything that is happening these days. But I wanted to take a further step back and look at what we're talking about back in 2024 and 2025, just to give an idea as to the progression into where we are heading. Now, from the rearview mirror side of things in 2024, we were very much focused in on the concept of engagement and how it really does matter. And participation when it comes to workplace health initiatives is really the focus, particularly around the subgroups with regards to who is most at risk of chronic illness or chronic disease, because they tend to consume a lot more resources, higher rates of absenteeism, higher healthcare costs, higher rates of presenteeism, all these sort of things. Some of the reasons as to why people invest in health and productivity solutions, usually targeted at those folks so that they can generate more interest in people embarking on a health improvement journey. And so that was one unique way of looking at things. We also talked about employee burnout not going away anytime soon. And of course, you did see that on the list this year if you've read ahead. Artificial intelligence at the time was relatively new, especially the large language models. AI has been around for a long time. I started doing work in AI, over 15 years ago, in applications in work disability programming and in case allocations and things like that. And, it's evolved a fair bit and continues to get better. In fact, some colleagues and I actually published a book on this a couple of months ago. Remote and hybrid work coveted by employees. It still continues to be coveted by employees. Great outcomes from a health perspective, great outcomes from a productivity perspective. with the wrong personality, it's probably not the best thing, especially contributing to things like loneliness and things like that. But it's definitely something that a lot of employees continue to gravitate towards. And then the other thing we talked about back then was the 4-day work week. Given the advances in productivity, given the advances in AI and things like that, it's definitely time to start considering this. The research evidence is quite clear that this is a solution that's got legs. It's very powerful. It's very strong. And so at the time, we were quite excited about the prospect of all of those trials that were going on with the 4-day work week and hopefully translating into more companies adopting that. Now, with 2025 came along, we definitely pivoted a little bit here. Things were changing somewhat. From the rearview mirror perspective, we were focusing in on healthcare costs. These costs continue to rise. We're seeing double-digit increases in employer healthcare costs year over year. That doesn't seem to be abating anytime soon. In fact, it's probably going to get worse in the near term here. From a mental health perspective, we still have a lot of issues. Stress, anxiety, burnout, depression, risks are high across the board. We have inflation, we have global conflict, we've got a whole bunch of issues that are weighing down on people and inside and outside of the workplace. And you can't separate the two. What impacts you at home also impacts you in the workplace and vice versa. And so we're not going to see any abatement of that anytime soon. Now, one of the things that we changed a little bit with our approach in 2025 was focusing in on this concept of flexibility with regards to how employers choose to allocate benefits and where they focus their efforts on. So remote and hybrid work are under pressure now. There's some return to office mandates. We use the term return to office rather than back to work because people have been working the whole time, and so a lot of folks get offended whenever you say return to work. Plus, it's something we use in the work disability space and absence leave and disability episodes. Health benefit plan structure, flexibility again is the name of the game here. I do a fair bit of work with GLP-1 agonists and helping folks understand the value of including them in the formulary and in the plan. These drugs work very, very well for helping people with obesity, with overweight, cardiovascular disease, steatotic liver disease, a whole host of problems. They're very, very, very powerful at what they do. And in fact, if these drugs continue to be used at the rates that we're seeing, we're actually going to see a significant increase in all-cause mortality in the U.S. By 2030, which is quite interesting, to the tune of about 5% decrease, because people who would ordinarily passed away are actually going to live a little bit longer. Now, the downside to these GLP-1s is that they have to be used in conjunction with lifestyle intervention. And so if you don't do that and you rely 100% on the drug, then you're going to return to baseline in terms of risk profile and in fact disease state within 12 18 months or so. So that's quite problematic because a lot of people are just using it as a band-aid solution rather than actually addressing the root cause. Now, women's health was another area of continued focus, which is great to see, long overdue. And then the use of AI in the workplace. We're starting to see this a lot more uptake in 2025. And then, as we correctly predicted, there has been some rollbacks of worker health and safety protections throughout the year. So obviously not the best year for us from a health and productivity perspective, but does help us put things into the light as we look to 2026. Now, in this case, what we wanted to do was name the trends for you so that you can incorporate them in your benefit strategy and wellness programming approaches. Provide a little bit of insight from an evidence-informed perspective on what you can do to help protect the outcomes, the budgets, the equity, that sort of components, and then really to help you design. This comes to incentives, communications, and really helps to put that different lens on things so that you can incorporate some of these ideologies into the approach as 2026 continues to roll out here in the near term. So in terms of what we settled on for this, we basically have a couple of different core ones driving it. Adverse mental health reaching crisis levels. This has been the mantra for a long time now. Every year we see more drugs prescribed for antidepressants and anxiolytic drugs, so anti-anxiety medications, than we did the year year before, and it just keeps going. There's a lot more people on these drugs than ever before. We also have diversity, equity, and inclusion under pressure from this perspective. And we'll dive deeply into each one of these. Next up is the AI, and then I'm looking at AI from a couple different perspectives. And then one that was kind of surprising to me, as I'll get into whenever I present that one, which is that the need for evidence-informed strategies are required, but not necessarily where you think originally. So this one is quite interesting from my perspective, and it's definitely an area of focus for me. So when it comes to the mental health conditions that we're seeing out there, there's a lot of issues in play. We're dealing with about 25% of workers, or about 1/4 of the workforce in the U.S. impacted. Now, this is a substantial number. And as I said before, it just seems to get worse every single year. Now, there is a higher impact and a more significant impact on younger workers. So those folks who are relatively new in their careers, especially in comparison to older workers. Older workers appear to be a little bit more resilient, but it may not necessarily be that they're more resilient. It's just that they're not necessarily reporting or coming forward as much. Now, younger workers, the stigma has been largely removed to a great extent. And so the younger workers are coming forward with struggles around mental health, and they're far more vocal and far more forthcoming with regards to that, which is really great to see, because in the workplace we have a unique position to help mitigate some of that risk and help these folks out. Now, when we layer in things like inflation, which we've been seeing, quite significant year-over-year increases, we're probably sitting at 25%, north of 25% even, since the start of the pandemic. So that's a substantial amount of change in a short period of time. And we've got an entire generation of people who may never actually be able to afford to live in their own home. The cost of living is so high, groceries is so high, everything is so high, and which ordinarily isn't that big of a deal as long as wages are keeping pace with inflation. So when wage increase is decoupled to inflation, that's when you have big problems. And that's what we're seeing right now, because wages have not kept pace with inflation at all. Now, something that employers are quite warm to, and have been for years now. In fact, we talked about financial health and financial wellness, I think back in 2023, as something that employers really should have in their toolbox to help support people. Now, unfortunately, I view this as more of a bit of a band-aid solution, because the more you unpack it and the more you peel back the layers of the onion, you see that this generation of people are, in fact, quite well versed in budgeting and all the things that we tend to focus on from a financial health or financial wellness perspective. We're very, very good at that. The issue is that the wages haven't really kept pace with inflation. So, we're really focusing our attention elsewhere when it really should be on, how do we reduce the wage gap in that perspective. And so that is something that causes a lot of angst and anxiety, and can lead to a whole host of other health conditions, because when you're under constant stress of making sure that you pay your bills on time, these sort of things impact your life in a broad sense. So when we look at reasons people reach out for help, let's say accessing EAP services, it's usually interpersonal conflict between the worker and the supervisor, or between the worker and their spouse or partner, or between the worker and their kids if they have any. And that's usually the strife. But a lot of issues can actually be boiled down to money, to financial situations in many respects. So when we're able to solve for some of those things, people have less worry, and they're able to change levels of engagement and levels of productivity and those sort of things accordingly. So we've got a lot of issues at play here that are dramatically impacting, and will most likely continue to dramatically impact mental health over time. And then on the diversity side of things, and this is something that'll make your blood boil as it does mine, women still only make about 85% of what men makes. And, that's terrible into as itself. Now, what's interesting is that when you break out down the data by career status and how long people are in the workplace, we see that number is actually shrinking. So the wage gap between males and females, men and women, is actually shrinking for younger women. So they're getting closer to wage parity, which is great. But it's, we still have a long ways to go. Now, we know that diversity, equity, inclusion has been under pressure in the U.S., and that is not a good thing whatsoever, especially from a health and productivity perspective. When we look at reports from the good folks at McKinsey and Company, for example, they've got research that clearly shows that diverse teams outperform less diverse teams by upwards of 40%. So, these are big numbers. This is, something that's quite game changing from that perspective. And the situation is getting more defined, and we have better data. So the folks at McKinsey have been looking at this for a few years now, and the latest report that they published was in 2023. And so what you're looking at here is the likelihood of financial outperformance based upon women representation or ethnic diversity representation or a combination thereof. And so what we see is that in the top organizations out there, there's more women, there's more ethnically diverse representation there. So that's where the darker squares are. So when you layer that in together, you actually have better outcomes. Now, the situation is even more pronounced for the bottom quartile. So those organizations not as high functioning, they actually have a lot less representation from women, less ethnic diversity. And then when you combine the two, significantly less performance there. So to the tune of 66%. So that is, if anybody ever questions why you want to link health and productivity with DEI initiatives, this is some great research and evidence to show that. So, this is just one area to take a peek at. Now, we look at things from a few different perspectives, and the next one on the list is the AI component. And there's really we could spend an entire day talking about AI. And where I chose to focus on with this year's report is really focusing in on digital health coaching components and what I'm calling digital biometrics. And I'll explain that a little bit, just as two examples of where things are moving with regards to how we can leverage the power of AI to get better outcomes, to drive higher participations, and to help move the needle and help support people on a health improvement journey. Now, the first example here, this was published in JAMA, Journal of the American Medical Association, in December. And what these folks did was they actually took a diabetes prevention program, which is traditionally led by a human for people with prediabetes or with overweight or with obesity, and basically helped steer them away from getting a diabetes diagnosis, type 2 diabetes diagnosis. And so these programs do work quite well. There's good evidence to show that they work quite well. There's factors that go into monitoring. So we're looking at changes in weight, changes in hemoglobin A1C, physical activity status, these sort of things. Now, what's unique about this was that the group actually compared a traditional approach to one with an entire AI-driven approach. So quite interesting. And if you want to learn more about the company behind that, I'm more than happy to share that. Feel free to reach out. And what they found was that the AI has got to the point now where the results were the same. So from a medical perspective, we call that non-inferior. So it really didn't matter if the people were in the human interaction group or in the AI-led group, the results were the same when it comes to the weight at 12 months, the hemoglobin A1C at 12 months, and then the physical activity over 12 months, which is phenomenal to see because historically speaking, we haven't necessarily got the best outcomes from these approaches over time. And now we're in really good shape where we can actually see this, we can replicate that. And this has great implications for cost containment strategies for employers, among other things. So this is a great win and some good news here. Now, the other one is something that I've been monitoring for a while. I actually did some work a long time ago on a derivative of this technology, this PPG technology, looking at near infrared spectroscopy. I was actually interested in the anti-fatigue matting that you see at your grocery stores, where the people are standing for long periods of time on that. And I wanted to see, did those mats actually work? Did they help with postural fatigue? Did they help with a bunch of things? And so the technology that I used is an early precursor to what we're seeing now. Now, this PPG technology is quite interesting because it's the same technology that's in your cell phone. It's in your camera. So we're using optical sensors to augment the amount of information that we have. So traditionally speaking, if you're running a biometric screening event, you're going to have to break the skin one way or another, either wet blood or dry blood analysis. And that's the gold standard. Of course, nobody's talking about replacing that. But in between those visits, we can actually supplant and support folks with getting estimates of some certain biometric values using just the camera and the cell phone, which is phenomenal. So, I started looking at these companies for 4 or 5 years ago. There's probably 4 or 5 different apps on my various devices right now that I've been testing and correlating and looking at the evidence. So basically, how they work is that they look at superficial blood flow in the cheeks and the forehead using the phone's camera, using the smartphone camera, and then they incorporate some pretty powerful AI to understand what the wavelengths of light that are bouncing back mean from a health perspective. And there's a whole host of different metrics that can be used here. So if we look at things like heart rate, respiratory rate, and heart rate variability, which is a very cool metric, we're talking, 96+% accuracy with regards to gold standard measures. Now, when it comes to hemoglobin A1C and hemoglobin levels, we're sitting at, let's call it between 73 and 80% or so. So we're good. We're not quite there yet where it could replace breaking the skin, but we're making headways here. And this is a great way to use that type of information in between health screening events and more formal visits. Now, blood pressure is another area that's pretty powerful. Systolic and diastolic blood pressure values, we're sitting between 83% and 88% or so. So again, very, very powerful information here and a great way to indicate whether or not further attention is needed. And this is a heck of a lot cheaper than running a biometric screening event, for example. You still need to do those and you still want to do those from a gold standard perspective, but for in between and monitoring and supporting people on their health improvement journey or even condition or disease management, these sort of things can actually be used quite well. So very, very exciting times. It's great to see that these solutions have come as far as they have lately. Now, the final one is a little bit different, and this one is focusing in on the need for more evidence-informed strategies to put in our toolbox as we support people from a preventive health perspective or support them on a health improvement journey. But it's really not where you think. I'm an occupational epidemiologist by training, so I specialize in population health and preventive medicine. Now, from a public health perspective, which is the correlate to workplace health, it tends to be underfunded, but we know that it's worth the effort. There's some great outcomes when we can actually do this, and vaccinations are a great example of that. With vaccine hesitancy that we're seeing now, we're going to see a resurgence. Well, we're already seeing resurgence of diseases that we had largely under control. Things like measles. This is going to kill a lot of people unnecessarily, unfortunately, and it's terrifying. Now, I really have received no training whatsoever in how we actually overcome hesitancy. And so it's something that, I've had to reach out to my colleagues and start to learn more, because you would think that a rational person when given the evidence and presented the evidence would make the rational decision that these sort of things are well worth it. But we're not necessarily seeing that. We do have a lot of misinformation and disinformation out there right now. Now, misinformation is false information that's shared without malice. So there's no ill intent. Whereas disinformation, on the other hand, is false information that's designed to intentionally mislead you. And we've seen a proliferation of this. You see it on TikTok, you see it on Facebook, all social media. The CDC, which used to be a reputable source for health information, is no longer a source that people are willing to use because it's been politicized and it's not actually based on science anymore. And so this is something, as I said before, that I've had to learn more about, because quite frankly, I didn't receive any training in this whatsoever. I'm reading a book by Neil deGrasse Tyson right now, and he's famous for a quote that said, "The good thing about science is that it's true whether or not you believe in it," which has probably never been more true than it is right now. Now, if you want to add something fascinating to your reading list as we try to tackle misinformation and disinformation and get people to truly invest in their own health, either from an organizational perspective or from an individual perspective, I've come across this concept called agnotology, and so that's what I'm reading about right now. It's looking at the concepts of willful ignorance and how a lot of things with regards to misinformation and disinformation have been creeping their way into our society and our culture for a little while now, and that's forcing us to become aware that not only do we have to deal with understanding risks and health risks and what we can do to control and prevent, but on the flip side to that is, how do we combat the misinformation and disinformation by design that's out there to circumvent all the good things that we're trying to do. So it's quite fascinating from my perspective. So take a peek at it. I'm reading a book on it right now. It's very interesting, and it's hopefully going to influence my strategies with regards to how I work with organizations and help them support their people and their plan designs with regards to supporting people on a health improvement journey. So fascinating things this year. Definitely a turn for the worse here with this one, but it's something that we absolutely need to face. We can't bury our heads in the sand and hope that it's going to go away because it most definitely is not. So with that being said, we are at time. I definitely appreciate your attention this morning. It's always my pleasure to give these webinars. We've got another one scheduled for February. Daryl will be releasing some of that information in the near term. It's going to be quite interesting. Colleague of mine, Ryan Picarella, will be joining me for a fireside chat, and I think we're going to talk about some very fascinating things. So that being said, please make some healthy choices. We appreciate your time and effort today, and I'm going to turn it back over to Daryl.
Thank you, Dr. Amell. As always, valuable, great educational content. We appreciate your time. Thank you for the plug. The next one is indeed February the 18th, and you should see an email coming out very soon. If you missed any portion or you'd like to get a recap, you can, of course, go to our website or reach out to Dr. Amell. Thank you and have a great day, everyone.